Good morning, Sheila.
Hi, Tom. How are you doing?
I'm doing well. You?
Pretty good.
Well, that's some big news, Sheila.
Yeah?
I was at downtown at the psych ward since I saw you last.
Oh, my gosh.
HCMC.
Oh, my gosh.
Yeah, they're pretty good there, but they put me on Zyprexa.
Yeah?
Fix me up. Now I come home, everybody's telling me I'm going to get fat and have diabetes and have to poke myself for the rest of my life.
Oh, boy. But you sound pretty concerned.
I don't want diabetes, Sheila. What can I do?
Okay, well, Tom, let me tell you a little bit more about the whole situation. You know the Zyprexa. It's a great drug. It helps it helps schizophrenic and people with brain disorders. It helps you clear up your thinking. It helps to get rid of the hallucinations, the voices.
It helped me. I just
decrease
don't
your
want
anger.
diabetes. I don't.
I hear you.
That.
Well, the deal is that the medications, they help the schizophrenia. They decrease and the serotonin and dopamine that cause the problem. On the other hand, they also affect other parts of your brain. Your brain is the endocrine system is regulated by your brain through the hypothalamus and the pituitary. And when you take this medication, it affects some of the other some of the other chemicals that regulate the endocrine system, which come through your brain, as well as there's some other parts of your body that are affected by the medication, perhaps the adipose tissue, skeletal muscle, and your liver. On the one hand, I know that the medication helps, but on the other hand, it looks like there's some challenges that we have to think about.
Mm-hmm. So what can I do so I don't get diabetes?
Well, the best thing we can do with this, I know that you're concerned about staying on this medication, but the best thing we can do is prevent the problem. Would you like to hear more about that?
I would, yeah. That's what I'm looking to do.
Okay.
The Zyprexa helped me out quite a bit, but I just don't want to have to poke myself.
Okay, well, the best way to prevent the problem is through monitoring how you're doing, as well as to change your lifestyle. The monitoring that we need to do would be, firstly, we'd like to check your body mass index. That tells us how much fat is in your body. We need to make sure that is between a certain amount, and then we're doing okay. We want to check your blood sugar at certain intervals, and that we want to make sure that isn't higher than 83 when you haven't eaten, and higher than 120 if you have just recently eaten.
Am I going to have to check my blood sugar 3 times a day like Grandma?
Well, I think that what we'd like to see is that you do it randomly, that you do it when you come in. We'll schedule various times, and we'll try to work on that.
Not at home, here, right?
Right,
okay.
Right, and we'll work on that together.
Okay.
Okay. Some of the other things that we'd like to check would be for your triglycerides and cholesterol. One of the other issues with taking these medications is it does increase the lipids in your bloodstream, and that has an effect on your heart system. So there's a number of things we need to do in terms of blood tests, and if we do that, you've just started on the med, and if we do it every month for the next few months, I think we'll be okay, and after that we'll decrease the frequency depending on how you're doing. I think the other most really important thing is diet and exercise. Those are the lifestyle changes that we need to have you make. And I do have some information on some of the dietary things, and maybe that could help you. Let me just go through that with you. We need you to eat a lot of vegetables and fruit, non-starchy vegetables, dried beans. Fish is helpful. Lean meats, things like sirloin and pork loin.
I can do that.
Take the skin off chicken and turkey. Choose non-fat dairy products like skim milk. Use water and calorie-free drinks rather than sweetened drinks and soda. Use liquid oil instead of solid fats. We want you to stay away from saturated fats and trans fats. Saturated fats, I need to have you, maybe decrease the amount of that. Those are the fats that are in dairy and meat products. And trans fat, which comes from fried foods and non-hydrogenated oil, those need to be eliminated completely from your diet. As well as look at your portions. Even if you're eating healthy food, if you eat too much, it can lead to weight gain.
Okay, so I've been knowing this for a long time. I need to eat healthy and exercise. That sounds right. I should be working on that anyhow.
Yeah, that's
all right,
good.
I feel a lot better.
I'm glad to hear that. You sound very positive about this.
Well,
now
I know
that
you're
we've
trying
talked
to help
about
me,
it.
and I know that the people at the hospital are trying to help me,
Okay.
and I feel much better. Thank you.
Would you like to see a dietitian?
Oh yeah, whoever. Yeah,
Okay.
I'd like to talk to people about how I can stay healthy. That's
Okay, Tom, that sounds really good.
yeah.
Yeah,
Well, thank you, Sheila.
you're certainly welcome, and please feel free to give me a call if you need anything else.
I'll do that.
Okay.
Okay.